Good morning and welcome back. Well, 'tis the season for when families get together, and with all that family gathering tends to come some illness. The flu is prevalent this time of year. We always talk about getting flu shots. And Marilyn Michels from Gunderson Health System is here with us this morning to tell us a little bit about this year's flu shot and the importance of getting one. Thanks for joining us this morning, Marilyn.
Thank you for having me.
We always talk about the effectiveness of the flu shot this time of year, and it seemed like earlier in the season we told people to maybe hold off a little bit. Is now the time that you should be getting one if you haven't?
Now is definitely the time. Our flu shot clinics will be closing down after Wednesday, so this is a good time to have a convenient opportunity to get the flu shot. You want at least 4 weeks before the flu season begins to develop those antibodies from the immunization. So this is the prime opportunity to get your flu shot.
Okay, so when does flu season begin? I was going to ask if the strain is different this year, but have we not really seen many cases yet?
We haven't seen many cases yet, but generally we see it starting to kick off in December, around Christmas time. So this gives you 4 weeks to get those antibodies built up in your body. So get your flu shot now.
Obviously, over past years, we've talked about how even in years where the shot hasn't been as effective as other years, it's still important to get it. But do we know anything about this year's effectiveness?
We won't know about the effectiveness until after the flu season, but we do know that we have a good match this year because the few cases that have developed, they match what we have in the vaccine. So we are very hopeful we're going to have a very effective flu vaccine this year.
That's good to know. Can we talk a bit about the flu mist as well? Is that okay for kids, adults? Who should be getting the flu mist?
Well, the flu mist is not available this year. They did studies and they found that it wasn't as effective the last couple of years. We anticipate it will be available in the future, but it's not available this year. So we have the immunization by the injection, or we also have the intradermal route for adults 18 to 64 years of age. Okay,
so there is still an option for some of those who maybe don't want to deal with the needle of the shot. Of course, it's still important, even if you don't like the needles, to still get that flu shot. This time of year is always the time.
That is definitely better than getting influenza. Right. I mean, that minor prick and a sore arm is better than getting influenza itself.
Exactly. And Marilyn, thank you so much for joining us this morning. That last-minute push to get that flu shot while the clinics are still on. We'll be right back with the check of your bus stop forecast next.